Chapter 6, Bones and Skeletal Tissues, Part 2. So, endochondral ossification. And when an embryo, there is a cartilage model, a hyaline cartilage model that is formed in basically where the bones are going to be throughout the body. And that slowly gets turned into actual bone tissue through a 6-step process. So, endochondral ossification. Initially, again, we have that hyaline cartilage model where most of the bones are, the bones that are not found in the skull. A ossification center will start to develop in the center of the bone where osteoblasts start to lay down bone tissue, and that becomes calcified and hardened. That will spread up and down the area that will eventually become the diaphysis. So that primary ossification center will be forming compact bone up and down and incorporating blood vessels into the bone structure. Eventually, it'll get near where the epiphysis will be, and then that is where it will stop. The primary ossification center will stop near where the epiphyses are going to be. But finally, we'll have a medullary cavity within the diaphysis and periosteum tissue on the outside. Next, secondary ossification centers develop in the proximal and distal epiphyses, so at both ends. Again, spongy bone tissue developing, blood vessels getting incorporated, it spreads out, slowly filling the area of the epiphyses. And then finally, it'll get to the point that we now start to see structures we expect. We have that epiphyseal plate, that sheet of hyaline cartilage where growth occurs. Again, this is going to be for an infant. Articular cartilage at the knob is the smooth area for forming joints. So, question, minimum number of ossification centers that develop when long bones are forming. The minimum number would be 3 because you have one, the primary one in the diaphysis, and at least one in each of the epiphyses, proximal and distal. So bone length occurs at that epiphyseal plate in infants and children. Basically, that cartilage continues to develop cells and make extracellular material and push downward the new material toward the diaphysis. As the cartilage gets thicker and part of it is going down into the diaphysis, that part pushing into the diaphysis will then calcify, will get replaced with bone tissue. So the children and constantly producing cartilage in their bones and having that cartilage get turned into bone tissue. And this allows the bones to grow in length. In adults, that epiphyseal plate becomes calcified, becomes bone tissue, and no more growth occurs. Bone width. Bones also have to grow in width, getting thicker. This occurs at the surfaces of the bones where the periosteum is. Basically, the osteoblasts will start producing extra bone material that will slowly wrap around blood vessels, giving us a little tunnel where we have the blood vessels on the inside and osteum on the inside, used to be periosteum, the bone tissue forming around by the osteoblasts, and then more and more tissue will form around that tunnel, giving us the concentric rings of an osteon, giving us the little rings called the lamella with the little lacuna filled with the osteocytes. Now, as the bones grow wider on the outside surface, they lose material on the inside surface. This is important so that the bones don't get very thick. We don't want the bone tissue to get too thick because then it'll be very heavy, harder to move. So instead, osteoblasts building up tissue on the outside, osteoclasts cutting away tissue on the inside so the bones don't get too thick. So this is bone remodeling, constant ongoing replacement of bone tissue by bone resorption, which occurs by the osteoclasts, and bone deposition that occurs by the osteoblasts. Note this here is a typo. It should say osteoclasts. Osteoclasts break down the bone tissue. Osteoblasts build it up. This occurs in all of our bones all the time. Something like 10 or 11 years, you have replaced all your bone tissue. So none of the bone tissue you have right now did you have in your little kid. Osteoporosis. Osteoporosis is a disease that can affect the elderly primarily. It is a dramatic loss of bone tissue and a breakdown of the bone structure. So you can see here the trabeculae of a nice normal bone, trabeculae of osteoporotic bone, lots of holes, thick thinning of the trabeculae, much more fragile, much more easy to break. This disorder is more common in women than men. This is thought to be for two reasons. One, men tend to have bigger bones, and women have smaller bones, so women have less bone mass, so the effect is more dramatic in them. And the second is menopause. After menopause, women's estrogen levels drop significantly, and it turns out estrogen stimulates osteoblasts, stimulates the building of bone tissue. Prevention, that is the best approach. So when you are young, say under 30, you should be doing lots of regular exercising, eating healthy, getting lots of calcium, vitamin D, protein, to build up your bone mass as much as you can, because after that, it's just a job that you can do is to try to prevent the loss of bone mass. So when you get older, continue exercising, continue eating healthy. That will help maintain the bone tissue. You won't be building up bone mass, but at least you won't be losing it, or at least not losing it too quickly. And then for people who do have osteoporosis, there are drugs that they can take to increase osteoblast function or reduce osteoclast function. Fractures. Sometimes we have accidents and break bones. A compound or open fracture is when the bone is broken and part of one of the bones is sticking out of the skin so you can see it and touch it. Comminuted fracture is when at the site of impact the bone is shattered into lots of small pieces. Sort of see that in the x-ray. Green stick fracture is where the bone breaks on one side, but on the other side it's still unbroken, but it is bending. So here we can see a green stick fracture. Impacted fracture is when the one end of one bone gets jammed into the medullary cavity of the other bone. Depressed fracture is when some sort of impact causes a depressed, pushed in area on the bone. This is more common in the flat bones of the skull. Boom, got hit by a hammer. Spiral fracture is when the fracture goes up the length of the bone and spirals around the bone. This occurs a lot in athletes, in impact sports, where their leg might be twisted very forcefully, causing it to break up the bone. Bone fracture repair. Well, first thing that happens after you break a bone is bleeding internally. You are going to damage blood vessels. And of course, to stop that bleeding, a blood clot will form. It'll be an extremely large blood clot referred to as the fracture hematoma. So blood clot, fracture hematoma. At the same time, a lot of bone cells will die because they're not getting enough blood supply. Over time, say 3 weeks or so, that fracture hematoma gets replaced with fibrocartilage, giving you a soft callus or a fibrocartilaginous callus filling in that space. This time, the bone tissue can start to repair, blood vessels can start to be reincorporated. As months go by, the fibrocartilaginous callus gets replaced with spongy bone tissue, with a spongy bone callus, bony callus. Blood vessels are repaired, are reincorporated, bone tissue is getting repaired, reincorporated. Then finally, bone remodeling, so that the bone has the arrangement that we expect, compact bone on the outside, spongy bone on the inside, depending on where the fracture is, and a basically repaired bone ready to operate again. And that is it for this lecture.